In this series, we're going to talk about toe x-rays. To start off with, you'd have your AP just like you would normally. So we're going to put those toes actually in the center there, and we're going to do an AP foot. Okay, so we talked about before, 15 degrees. Good job. I'm going to put your foot just like that. Oh, you kind of move back a little bit. About right there. Okay. Mr. Wiggles. There we go. Marker, just like that. Okay. So AP. The oblique, same thing, although we are going to just collimate down to the toes themselves. Relax your foot, baby. There you go. Good job. So I'm keeping my hand on his foot, but I'm going to move it for the x-ray. I wouldn't necessarily keep it there. There we go. Marker. Squeeze it in just like that. So we're going to turn him just like so. And that same oblique that we would do for a normal foot. There we go. About like this. So now when you get to the lateral, it depends on the toe of interest. If it's your great toe, your second, you would turn them in or medially and try and retract the toes back. Okay, because you want to try and get that single toe in view. Now, how do we do that? Well, you can do a couple things. I like to use tourniquets. You can also use tongue blades that are really nice. That doesn't cause a lot of artifact or anything. We can turn them to the inside, and again, you can do something like that. Oh, what? Your little toes. Something like so to try and isolate the toe itself. Okay. Just relax. So I'm going to try and just get this all set up, and then we're going to do it just like that. Okay. So something like so to separate the toe itself. A lot of people would say like, oh, I'm going to use my pen and I'm going to push that out. Well, that's all fine and good, but number one, it doesn't separate these toes here. But then two, you can get some artifact, or even some people forget to retract the ink stylet, and so they put that on the foot and they're like, oh, well, there's metal in their toe. Well, it's just from the pen. So I don't like to use pens. I like to use, again, tongue blades. I've used syringes because that's what I had, the little plunger part, putting it on the toe, pushing them out. If it's the middle toe, good luck, that's in the middle. You can go midline, or you can turn them medially, or you can turn them laterally. It doesn't matter. It's still going to have angulation, or not angulation, but magnification on it. And if it's the fourth and fifth toes, you'd go laterally, and again, trying to retract the toes as best you can. Turn them to the inside, and you may have to use a combination of things. I've had so many different contraptions like worked up so that I can get toe x-rays appropriately. So you can have parent hold the tourniquet if you can get it. Does that tickle? Yeah. And then, so he's holding those toes and I'm holding this toe. And we're gonna center on that toe. Put my marker in there, and just like that, we get a lateral toe. Make sure that they're not rotated, you know, medially. Make sure they're nice and lateral to the toe, okay? Central ray. I have a little farther back just because the toe is so thin. Your penetration won't be adequate, okay? And that's how you do a toe x-ray.